Good morning. Welcome to Salina Regional's Morning Medical. Today's program, I have with me Dr. Justin Klaassen. Dr. Klaassen is a surgeon with Salina Surgical Associates and also the medical director for the wound care clinic at Salina Regional Health Center. And that's what we're going to talk about. So with the wound clinic, if you could kind of give us a little brief introduction to it, and at what point in time do patients come and see you there?
Wound care clinic really specializes in wounds that are chronic, wounds that have been around for weeks to even months possibly and just don't seem to be healing on their own.
How do these wounds develop?
There are several different types of wounds that we see over in the wound care clinic. They can be a result of diabetes. People have a lot of foot wounds with diabetes. They can't feel their feet, and so they can get injuries to them. It can be poor circulation, either arterial or venous circulation problems. They can be incisional wounds that haven't healed well for patients, and they can also be due to trauma. And that could be from several different traumatic injuries, and including sometimes we've even seen frostbite here recently with the cold weather.
Okay. You'd mentioned the diabetic patients, and so to try to keep from seeing you, you mentioned how they develop, but are there some things that the patients can do prior to keep these from developing?
The best thing first and foremost is to follow up with your primary care physician very closely. Help them to understand your diabetes and let them help manage your blood glucose levels so that you're well managed there. Additionally, diabetics are very prone to foot wounds. Sometimes are associated with neuropathy where they can't feel their feet very well. And so if they step on something and get an open wound, they may not know about it until it becomes smelly or bleeds or something that becomes very obvious. We teach them to examine their feet, to keep them clean and to keep them dry, but also to follow up with an orthotist or somebody to fit them for appropriate fitting footwear and also inserts to pad their feet so that they don't get ulcers.
Okay. When you're seeing a patient and send them home, I assume there's some education that goes on as well. What type of responsibility does the patient have at that point in time?
We've got a great nursing staff over at the wound care center. They're very good at educating the patients on what their wounds are and how to manage them. We talk to them about why their wounds are developing and what they can do to prevent them from reoccurring. And we also teach them about the different kind of bandages that they have and help to supply them with bandages so that they can get these things at home and treat them and manage them by themselves many times.
Okay, and I know a lot of these wounds probably are not life-threatening, but in many ways you can kind of give some lives back to some patients, correct?
So wounds can be physically debilitating for the patient and also emotionally debilitating. A lot of times we can help control that in the wound care center, get rid of the dead tissue, control the infection, and help manage the drainage so that it's not a problem for them anymore and they really kind of feel like they can get back out there and start living their lives.
Okay, thank you very much. Thank you for watching. For more information, please visit srxc.com, like us on Facebook, and follow us on Twitter.